Good morning. This is Dr. McDaniel, GYN Corner. We have obligatory exercises for my kids today in our neighborhood. Jacques, je te vois. Continue, je vais ajouter 5 minutes. The kids are relatively... Hey, good morning. Great. How are you today? Nice out. Good. That's for sure. The horse riding lessons. My younger son does boxing a couple times a week. He'll be 12 this month. My older son, since they stopped taking Irish dance classes, which they had taken for about 7 years, he doesn't do very much. He does marching band, but that's only a couple of months out of the year. Outside of marching band, it's kind of, he's not very active, and he's pretty big. He's 14, he's tall, he's almost 5, he's 5'10" and a half. He just turned 14. He's not overweight, but, you know, he's a kid. He should be exercising every day. He should be in good shape. So he can get out of shape when he's middle-aged. But right now, as teenagers, as young kids, they should be. That's my 14-year-old. He doesn't like having to be forced to do exercise. But you know what? If he did it on his own, voluntarily, I wouldn't have to force him. So they're doing 30 minutes of bicycling. The girls like bicycling. They usually do it a couple times a week, but they don't like it when I force it on them either. So it's 30 minutes of bicycling today. And let's see. I thought about what to talk about today, and as the title says, I'm going to speak on, I'm sitting in the garage, of course I'm not getting any exercise at all. I'm going to speak on dense breast. And I thought about speaking, as you know, I can't lift my left arm, it's broken. Thought about speaking on dense breast because I see that a lot. And dense breast is a mammographic finding or a comment. It's not an actual. So the actual is fibrocystic breast changes. So when someone has a mammogram, if it's very blurry and whited out and difficult to see some of the features that they usually look for to confirm that the breasts are normal, they'll say the breasts are dense. See that quite a bit, and the patients ask me, what does that mean? So, as most people know, a mammogram is simply an x-ray. It's an x-ray of the breast. And x-rays are really good at picking up bone. They're not so good at picking up features that are soft tissue, like fat or muscle. So, the reason why we use x-rays to evaluate the breast is because if someone has an abnormal growth that is pre-malignant or malignant, it produces hormones to increase blood supply to itself. And we call that neovascularization. So it creates new blood supplies because it's a new growth and it's growing rapidly. It requires additional or increased blood supply to support its growth. Evidence of that new blood supply to support its growth is usually seen as little speckled white spots on x-ray. We call those calcifications. So anywhere you have increased blood supply, increased vascularity, or if you've had abnormal bleeding, you'll have evidence or traces of that because you'll have calcifications that are evident. So an x-ray is good at picking up structural changes and blood vessel vascular changes because abnormal growth garners an abnormal blood supply. So we look for calcifications on the x-ray, which is the mammogram, and we look for structural changes because a mass or a growth will displace certain normal structural or physical features in the breast. Now, if there appears to be abnormal thickening or tissue displacement or calcifications, then of course more work is needed to evaluate those areas. However, if someone has a mammogram done and you can't really discern the physical features. It looks kind of foggy or whited out. We call that increased breast density. And that's because the breast should be mostly made up of fat. The older we get, the saggier the breast get, and the breast gets saggier because a lot of the firm structural ligamentous tissue, so to speak, is replaced with fat. That's why younger women have perkier breasts, because it's less fat present. Older women usually have saggier breasts because there's more fat present. X-rays penetrate through fat very easily. They don't penetrate through thickened tissues or through bone easily at all. So ideally, one should have a breast that's predominantly fat with just ligamentous structures or suspensory structures, the thick collagen bands of the breast present. That would be the normal feature. If the breast is mostly thick, firm, ligamentous or collagen features, then you're not going to see a lot of black or dark areas where the fat's being penetrated through. You're going to see almost like a bone type of evaluation. So it's going to be a lot of foggy, whited out breast tissue. That's what we call dense. Now, dense breast tissue is very common in younger women because, as I stated, there's less fat present. It can also be common in women who have fibrocystic breast changes, or they have very tender, sore, achy, lumpy breasts because their breasts are very hormonally responsive. So the hormonal changes that occur during ovulation and after ovulation and with the menstrual cycle, they stimulate breast tissue because breast is a hormonal organ, and the breasts get more tender and lumpier because they stimulate cystic or liquid production in the breast. If someone has fibrocystic breast changes all of the time and it's just exacerbated with their cycle, then they're going to be a poor candidate for just a simple mammogram, because the mammogram is a screening test and it has a miss rate. The miss rate for masses or growths or lumps for the mammogram is between 15 and 20%. The average is about 15% and the lowest will be 10%. So the catch whenever a mammogram is done is that someone can walk in with a lump that they're concerned about, and the mammogram can potentially not see that lump for a variety of reasons. The main reason could be that they have dense breasts. The breasts are very thick and firm, so a lot of the tissue is just whited out. You can't discern any structure behind it. It's foggy. Or it could be that the mass itself is the same tissue thickness or the same tissue density as the surrounding normal tissue. So mammograms are relying on a tissue change between the normal and the abnormal growth in order to detect it or to pick it up. So whenever anyone has really firm, thick breast, or they're really young, so they will naturally have firmer, thicker breasts, the mammogram is not a great screening test to look for masses or lumps because it has a miss rate of about 15% anyways. And the firmer, the thicker the breast, the more whiteouts present, so that miss rate is going to be even higher. So whenever anyone has what they call a fog out, or what we say is a dense breast seen on the mammogram, they're supposed to have additional testing. And I'll go over what that additional testing is tomorrow. Thank you for joining me. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel that's also called GYN Corner. Have a great rest of the weekend. Bye!